Thank you, Dr. Monica, and thank you, Hindi team. Now we are moving to our English session. Today we our 1855th day of continuous webinar. Before beginning the session, we'll have a silent prayer. Good evening and welcome everyone. Today's our guest is Dr. SADAT. Dr. SADAT, has he joined? Anyway, I will introduce him. Let him join. And Dr. SADAT is his chief physician in Dr. Sait's Homeopathy, Cochin and Alua. He is running clinic in Cochin and Alua. He's the leader of various homeopathic association, especially he's working with QFA, Qualified Doctors Association, and he has taken classes in our forum in 3 languages. And today's our class is about management of dermatological problems with homeopathy. I'm inviting Dr. SADAT. I think Dr. Dane, yesterday we have celebrated our 5th year. And in the English webinar also you have we have celebrated the completion of our 5th year. Thanks to everyone for joining with us. Thank you all the participants, because if you are not participating in this webinar, we cannot run this webinar like this. Actually, what you have to do, every one of you must subscribe our channel, IFPH YouTube channel, and you have to watch the videos again and again, so you will become familiar with that. And before also, I'm requesting the same thing. Those who can open the cameras, if you are in comfortable position and you are ready to open, means please open the cameras and watch. That will be inspiration for the speaker who is taking classes, because when I am taking classes, I wanted to see some face and their reactions about our class. So I think, thank you, Tariq Zubair, Doctor. Thank you so much, because when we are talking to someone, we have to, thank you, Dr. Sushama. Thank you so much. If you have anything, you can switch off the camera. Just open the camera, and because only yesterday also I met many of our participants, and when I'm facing them, I couldn't understand, because whenever they are saying the name only, I can understand, because when I'm accepting through the Zoom webinar, I'm reading the name. Otherwise, they are identifying me, because I'm okay. Doctor has joined. Now will. Doctor, I made you as a co-host.
Okay. Can you hear me?
Yes.
Sorry, patients are still there.
Tell them to wait. We are waiting here.
Huh?
See, I requested the participants to open the camera, so you have many more faces today.
Okay, very good. Okay, let me share it.
Thank you, Dr. Chandrika Mohan.
Yeah, go ahead.
Thank you, Dr. Rekna Sundaram. See, today you can take the classes to the persons directly, seeing the face. Okay, you can start now, doctor.
Okay, I'll start with some very good skin complaints. Okay, straight away to the pathological skin complaints. Okay, can you see me?
Yes.
Okay. straight away into the pictures. Okay.
Yes.
You can see two legs.
Yeah.
This was result of an Ayurvedic treatment. It is a cellulitis. Whole body, whole leg was a cellulitis. They tied something with Ayurvedic. This one they over tied or they didn't do repair. I don't know. This lady was my patient. So they went for a knee pain came. They went to the Ayurveda people because it is considered the best. So they went there and she got the total cellulitis. Okay. See the different stages with our medicine. Okay. It is healing and see the leg. Okay. I'll show you once more with the stages of healings. One. See it started healing. Okay. One by one by one. See the stages. It is second week or second week of the treatment. Then every 5 days, we take the photos and see the skin. Okay. So this is the case. I will explain with the medicines. Patient name is Roma, age 59, chief complaint osteoarthritis, and this skin complaint is due to the allergic reaction to the Ayurvedic treatment. Medicine what we have given is calendula, echinacea dressing, and the medicines given every stage. When they started healing at first stage, we gave Restox, Epismel, and Staphylococcin. Staphylococcin to reduce the inflammation or bacterial and secondary inflammation and infections. This is every 2 days I have changed the medicines. Okay. Every 2 days we have changed the medicines. And calotropis. Calotropis is one of the best medicine for such an inflammation. Calotropis, the doctor knows signature is if the calotropis drops, it falls in our hand, it comes with the blisters. Okay. So calotropis, graphitis, and petroleum. Petroleum is in the last stages when there is dryness. We are given it at this stage. There is no discharge. Okay, the skin changes this way. There is no discharge, and the skin peeling is there. And these are the stages we have to think about petroleum. Once there is a discharge and stickiness, you can think about graphitis. And graphitis is one of the best medicine for the skin. I repeat graphitis every 1 second. Jan, I will be late. Now 9:30. Okay. Class hai, rak class elute. Sorry. Okay, these are the stages where you can use the graphitis. The difference between the graphitis is a sticky discharge, and this is a normal without discharge. That is the main difference between petroleum and graphitis in the skin complaints. This is an acute complaint, so case taking only restricted to the part affected. I have not gone into the constitution prescription because it's acute emergency. Constitution medicine cannot be given. It can come up with a flare up. Okay, so it has been managed only on the acute level, only on the skin level, because it's an emergency condition. We have to give medicines. Okay, so this is the situation we have faced it. It is the best medicines and the skin complaints. This is one case. So calotropis is given when the blisters were there. And echinacea tincture. Echinacea tincture has been used because echinacea is one of the best medicine for antiseptic. Septicemia, it will clearly stop the septicemia. It will not allow further up with the septicemia. So these are the medicine we have to use it when in emergency. Septicemia can be used at any time. Okay. So this is case number 1. Okay, sorry, yeah. എടോ ഒന്നും ഓഫ് ചെയ്യണ്ട, തമ്മിൽ പൊക്കോ. അവിടുത്തെ ഓഫ് ചെയ്യും, അവിടുത്തെ ഓഫ് ചെയ്യും. Okay, this is another case. It is an ulcer. It is a varicose ulcer. Okay, pictures I'm showing it first so that you get convinced, and then this is the stages of healing. Okay, see the difference. See the difference. One by one by one by one stages. Ulcer is healed, almost healed. See the difference. You can see the difference. There are two photos. You compare it. It's easy for you to compare. See this. See the difference. This is the first stages when the patient came. First week or second week. See the varicose ulcers and the skin complaints. Too easy to. I don't have to tell you anything. This is the pictures tells you everything. How homeopathy can help in this severe cases of ulcer also. Okay, this. See this. Okay. Patient name is Mary Philomena, age 70, chief complaint, known healing varicose ulcer of 7-year duration. And this has been done with a skin graft also, that also got rejected. Okay. And the medicines used are very simple: Cephalinum, Merxol, Vipera, Calendula. I will explain it to you when I've given the sequel core because it took little more time because of the age factor is there. Blood circulations will be less. So every 2 years we have to keep changing depending on the changes seen in this. Echinacea, pyrogen, it went into inflammation also. So it depends upon the doctor and the seniority and things the confidence to convince the patient, convince the relatives to do this because they never had any option also. Skin grafting is also not possible. It is getting rejected. 7 years she has been waiting. Nothing was happening. And they came to us. It took almost 3 months for this ulcer to heal. Okay. So medicines used as curcuma longa dressing. Okay. And silicea higher potency has been used. I have used it in this stage. I'll tell you. Silicea, this stage. Because see the silicea, it is edges are very thick in one photo, right sided, my right side. The edges are very thick. So silicea has a this one. Silicea has a affinity for the thicker skin to heal. Granulation tissues will be formed even with the thick skin. Thick skin has to come and heal. Okay, this has been this I have got it from Dr. Ismail Sets, a senior consultant. Yesterday you must have seen it, and you must be seeing it every day also. Okay, so it depends upon where you use your medicines, how often you use your medicine, and the Silicea 1M 1 dose, 10M 1 dose, weekly once. Okay, and tinctures has been used frequently also because it's not easy. I don't want to go into septicemia and the next stage is amputation of the leg, which I wanted to, at any cost, I have to stop it. Echinacea again, septic conditions, you give it every dose, 10 drops, 4 times a day, 10 drops 2 hourly also, if depending on the cellulitis and the inflammations. Pyrogen, she had in between inflammation because this got aggravated because her house is there was a rainy season. Her house was full of water. So that time it got infected again. Then the medicine changed was into pyrogen and staphylococcin. Curcuma longa again, antiseptic, 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 antiseptic. There's nothing more to tell you about the curcuma longa. Okay, curcuma longa is Indian antiseptic. You can use in any conditions. Okay, CKL core again, you know, it's all common medicines. I've not used anything big deal. So this common medicines, carboveg is one of the best medicine even for this one, our uh, varicose ulcers, varicose vein, arsenical, slowness of the this one, itching, blackish discoloration of the part, and arsenic album is a very good medicine for the ulcerations. So, which all see it does depends on the where you use what medicine. That is the most important. See these conditions. This is the apt position for arsenical. All the skin are blackish. The skin around the ulcers are totally black because of the graft. She has been suffering for a long time, and the skin is very tough. Even thyroidinum can be thought about. Hydrocortisone. Hydrocortisone is one of the best medicine on the skin. Boric says it is Geja Charma. Geja Charma is like the Geja means elephant. Elephant thick skin. Okay, that is called that thickness. In this case is a thick skin. But arsenic brought me little improvement, and so arsenic was used. Okay, so condition every 2 or 3 days you have to review the case. If patient can come, review the case every 2 or 3 or a week. Okay, syphilinum is the punched out ulcer. Punched out ulcer, syphilinum. See this right side ulcer. Situation has come with the punched out ulcer. Okay, see there was something which you have to depend on. I don't know how many doctors of homeopathy has taken this kind of cases. For me, when I took this case, it was a recent case, but it needed little confidence. I was not too lacking on that time. But that first case gave me a confidence of saving legs. I was not taking the case. I was referring the cases to the surgeon. But these cases, I never had any choice. So I have to take it. Patient has come with the confidence. Come what, we will heal it. It's possible. So these are the stages where we can give all the medicines wherever possible. Staphylococcin is a case you can think about in all the cellulitis. Start with staphylococcin so that the celluloid this one what are called uh, septicemia can be stopped. Okay, repetition. I have repeated frequently because weekly ones, not weekly ones, every day 2-3 times because of the condition I have seen in front of me. Okay, and I cannot ask anyone. When I said send the photos of this sort, they said we have not seen the cases to the seniors. So there's no other choice left out with me. You have to do it. Okay, see this case. Again the cellulitis. See this. And the difference. Simple photos explain it to you. Okay, but this was one of the difficult cases. This was one of the difficult cases because she was a renal patient, creatinine was high, plus she was a diabetic patient. So treating this type of cases is too difficult. You need to uh, be double strong. The patient is Susan Simon, age is 54, diabetic cellulitis. Medicine used are acid first to control the diabetes. Acid full tincture only has been given. Every 2 hourly 5 drops. And there is a medicine called fluoradjin. Fluoradjin easily, what are called, fluoradjin is something which it is got from the apple peel. And this is the apple peel, it is comes with the, and fluoradjin is one of the best medicine for diabetes. It is there in the boric. Read that. Spelling is PHLOREDSIN. Fluoradjin 30. Medicine used are acid first tincture to control the diabetes. And the patient was admitted in the hospital also when the treatment was going on. They said we cannot do anything. First, we will take care of this, but nothing could happen. And they got discharged and came home. That time they came to. Okay. Again, Merksol, Silesia, Epismel, and Hepasol. Hepasol patient is very sensitive. Calendula tincture and Myristica tincture. Myristica tincture is an antiseptic. Again, I have given all this in 30 potencies because pathology was this one, diabetes also, and I had to repeat the medicine every 2 hourly so that it comes in the control. Otherwise, septicemia and amputation, nothing else. And this is done in 2 or 3 weeks time. Okay, and this is the change. 3 weeks time we could bring her out, bring her down with the septicemia saved, but maybe after a year or two this patient expired because of the renal issues. Okay, she is no more now. But this was one of the beautiful cases which it all taught me how to take such cases and treat it successfully. The confidence what this was been given. Again, this is diabetic ulcer. See the cases. See the cases. Diabetic ulcer. Patient didn't know that. See the difference. Okay. This case, I'm not revealing the name. Okay. The medicine given was acid force, Merksol, Silesia, the same medicines. Merksol, Silesia is one of the best medicines which I have ever used it frequently in this case. Cephalococcin. The wound was deep, very deep. Pus was there. Patient didn't know this was pus. I am not going to reveal these cases because this is a known case, known patient. Okay. And see this difference. Okay. It took almost 2 months, more 2.5 months or something of that sort to heal this. Medicines was again controlling the diabetes. This is diabetic ulcer on the heel. Okay. This medicines are again Merksol, Silesia, gunpowder, acid phos. Same medicines what everyone knows. I have not repeated or not seen anything. Okay. This is, see the difference. I'm putting again and again because I'm too, what I call, excited to see these pictures back again. Okay. These are the cases. Okay. This is another case of gangrene, wet gangrene. I will explain every picture one by one. First you see the pictures. This was the case posted for an amputation. Okay. These are the difference. See the healing, huh? See the skin. Again. Again. And this patient comes to me not for this. Once in a while, he comes to a Cochin. He comes and visits me. He is a priest. Okay. See the healed stage. This was little before that. This was the first stage. Okay. Anything is possible with homeopathy. This is the investigation. Okay. Reports. And surgeon is clearly told go for an amputation. This is the next time I will maximize it. Hope you can see this. This is the Doppler study. Okay. This is a patient name is Prasad, 62 years. Medicines, I'm not repeating it. It's all the same medicine. Silesia, Vipera. Then Vipera is one of the best medicine for varicose ulcers and varicose veins. Vipera, the only symptom we can get it is hanging down aggravation. 90% of the varicose vein and varicose ulcer will have that symptom. So Vipera is one of the best medicines for this. Okay, and the story behind this is the patient started with me. Then it was just not, it was responding, but not to the expectation of them. And the son was a little far away from them. So he saw the plight of father. He took him to the surgery. Surgeon, he said, we have to amputate right now. So they called me up and asked, what is the situation? What can we do? You said you bring it here, no surgery, it will heal. Okay. So relatives, parents, the wife was confident, but the relatives are not confident. The son was not confident. He wanted a second, third opinion. Took them there. They said nothing can be done. Surgery, amputation, circulation was less. So again, CKL core. Then Vipera, Merxol, Silesia, gunpowder. Every 2 days, 3 days, we used to change the medicines depending on the stages. So observation is most important because it's a wet gangrene. Okay. This was another case. See the difference. See the healing process. Okay. Again, the patient name is Matthew. This was pathetic case. Yeah. See the skin. It was a psoriatic cases. And this has been healed properly. Now the patient has a cancer. But that also we are giving the medicines in collaboration with the Cancer Institute. He is under our treatment. Ravi, still alive. For this, I give what is that medicine? Hydrocortisone, thyroidinum, Merxol. Okay. So these are the 5 cases or 6 cases. Again, another slide is there. Another one more slide is that we'll have to go for the different day. Medicines are just 5, 6 or 7 medicines, whatever in the Mathematica, we can treat any kind of cases. And one more, this is not a skin cases, one more experience I want to tell you is, I have a case of what are called uh, congestive cardiac failure, and the this one heart is not getting pumped, only 20% when the patient came to me. His name is Srijit. He is still my patient, and the best thing is that 20% went into 60 percentage now. Right now, last week they went in for a complete checkup. It is 60% pumping has come. So homeopathy is also too good in cardiac. And best thing I wanted to tell you is that last month he was under total stress with his daughter's what to call housewarming, and daughter's husband was also in the hospital. So he was running around towards that, and suddenly he developed tachycardia. He drove down the vehicle to our clinic. In front of my clinic, the pulse was 240, BP was almost that, and I was in a panic state of affairs because it needs hospitalization, and fibrillation has to be given that with the machine. But patient was not even budging to go to the hospital. I said, nothing doing. I'm going to give you medicines. I gave him opium, morphine, adrenaline, cactus every 5 minutes. Amyl nitricosm was not there with me. Every 5 minutes, 10 minutes, monitoring it. Pulse was coming down. When it was 160, 240 to 160, I said, I don't have the facility here. Otherwise, I wouldn't have sent you. Go there, get this done. And by next day, patient was discharged from the hospital, came back. The hospital people said, how could this come down without medicines? 240 to this one in, and he drove from here to the hospital 2-3 kilometers in the same car, reached there within 15 minutes. They took that. So asked them what was the pulse. I said, doctor told me it's 240. CVA was not there. How could it come down? He said, doctor gave me homeopathic medicines, and I am his patient since last 2 years, and it's going on. It's beautifully. Now, after discharge, next day he got discharged, and after that he came here, and we started the cardiac treatment. So all this is possible. Okay, I showed you few more cases of 5, 6 cases. Now I'm going to stop this, and I'm coming to the regular skin complaints. If we have time. Okay, what we can think about it, how things can be thought about it in a different. Just checking it out. Okay. Can you see me?
Yes.
Okay. This is a common cases which comes into our clinic. Very common cases which we come into our clinics. I'll start with melasma. Pimples. Simple. I don't have to explain and go into the theories. There is for the layman now on this. Layman will tell you much better theory than us. Okay. But few things we have to see for the pimples or any face wash, or before using any cleanser or anything of that sort. Wash your face with lukewarm water. Don't ever use hot water. Don't ever use, you can use, don't ever use the very cold water. Better one is lukewarm water. Lukewarm water balances the oil. It opens, it cleanses, it cleanses the dirt, and it it helps you to use your cleanser. Cleanser also, homeopathic cleansers, a lot of medicines we have as a cleanser. You can use it. Cosmetics, Homeopathy is something which you cannot, you have enough and more medicines. Okay, pimples come every day to your clinic. Every day. It's a day-to-day business. Okay. So homeopathic medicines, these are the common medicines we use it. Asteria rubens tincture can be used as a very good cleanser also. Sulfur iode medicines are, the pimples are very hard. Natronure, I don't have to explain. Belladonna, again the pus and redness will be there. Pulsatilla is a common, but whenever pulsatilla has been used, you have to check it for the PCOD. Every pimple cases, you have to rule out PCOD. That's the first thing you have to think about it. PCOD plus dandruff. PCOD and dandruff is the two things which you have to inquire and you have to read and you have to rule out. So once we treat the once we treat the pimples, if the PCOD, if the patient has a PCOD and if that is not addressed, pimples are not going to be better, and you cannot even treat the pimples in a proper way. Okay, so treat the root cause, pimples will go off. You can give medicines acute also to take care of the pimples, but hygiene with homeopathic medicines is a must. External application, I don't know, aphorism 6, not aphorism 6, 6th edition, boring, 6th edition, Honeyman. Go refer the last few pages. You will give external application. He was coming into that. At least to that level, we have to take out homeopathy uses instead of all this chemical market cleansers. Use our homeopathic medicines. Use our homeopathic medicine. Hydrocotyl, Berberis acufolium. But whenever you use this, this has to be in a very diluted way. Tincture used, but don't put too much of quantity. Okay, too much of quantity will irritate. So these are the simple things you have to take care of. It comes with the experience. You take it if it is that if you are taking one glass of water, 10 drops or 20, 15 drops maximum you can put in one glass of lukewarm to clear your face. Or if you're taking a bigger cups, accordingly increase and decrease. You can use hydrocotyl for everyday cleansing. Put it on the this one, lukewarm water. Hydrocotyl, Berberis acifolium, chamomilla, then our Jabaranti, myristica is an antiseptic. Again, you can use it for the patients. So external medicine, how does it, skin absorbs our medicines? That way, that helps you to heal also. Calendula application. Calendula is another one medicine. Calendula application, if you give it, skin heals. Same principle applies for your cosmetic cleansing also. So instead of all the girls or anyone who is facing it, instead of giving the cosmetic, this chemical cleanser, you can give our medicines. Okay. Sarsaparilla cleanses our blood. That is the best thing. What we call it as Narananti. We use it as Narananti. That is a herb. So sarsaparilla can be used. We give it in renal stones. Most of the use of sarsaparilla is in renal stones. Sarsaparilla can be given in the cracking of the crack of the heel cracks. So sarsaparilla is one of the best medicine. Thiocinaminum is one of the best medicine for the scar. The scars will reduce. Okay. Antim crude, again the scar. Kali iodide, this one the pimples are very hard. Radium bromide, skin, crops of this one, crops of pimples come in. When in crops, think about radium bromide. Radium bromide also can be thought about any skin complaints. Okay, plus chemotherapy effect, after effect of chemotherapy. Radium bromide is one of the best medicines of after chemotherapy. Again, Bovista, pimples after cosmetics. Even the bindi, Indian woman use the not bindi also plus this sindoor. Nowadays, previously they used to use the proper herbal sindoors. Nowadays, all synthetic sindoors come. So all the sindoors plus This one, bindi, that bindi all the Indian woman uses. Any eruptions or any cosmetic problems arises from that. Okay, kali bromatum, it is one of the best medicine for pimples. And another common medicine we can use it as a juglans regia. Juglans regia. Juglans regia, blind you can give it. I'm not saying that case need not be taken. Case has to be taken, but if you don't get a detailed things, think about Juglans regia, Eugenia jambosa, Simicifica, Actia racimosa. Actia racimosa is a female remedy. You go through that. Uterine remedy plus joint pains, bigger joints. Actia spicata for the smaller joints. Actia simicifica is one of the best female medicines. It can be rated as a pulsatla. So use Metria Medica has lot of medicines. Use it in a proper stages anywhere. You will get results. Juglans regia is one of the best medicine for axillary abscess, specific to axillary abscess. Okay. Use homeopathic phase lotions. Phase lotions, Oleum jacoris, Berberis acifolium, Tinger glycerin. Tinger glycerin is one of the best medicines, but tinger glycerin before use it, glycerin has an ability to absorb moisture from the skin. So before using it, don't use this medicines very frequently. Tinger glycerin especially. Hydrocotyl, again, Jabaranti. Huh. This salicylic acid. Salicylic acid and lactic acid. Why this? We have medicines. Now, if you take any serums for pimples, it is both the it is made up of glucuronic acid is also one of that. Salicylic acid and lactic acid. It's one of the best medicines, and it is one of the commonest medicines used in the serum, face serums, and youth are after that. We cannot say anything. It is youth are crazy for it. Why don't we use our salicylic acid? How do I make it as salicylic acid crude form? I take it. I get it from the pharmacies. Right now I have it. Lactic acid also we get it crude form, and we put RS and make it tincture. From there we dilute it with again with either rose water or this one saffron. Saffron we make it. Saffron you get it. Indian saffron, Iranian saffrons. We use it in the biryanis and stuff like. Saffron water you make it. You can put it on the rose water, herbal properly made rose water, not the synthetic ones. Put that also in that. Rose water also, that saffron water is very expensive, but you can make it at home. Use that. Face scrub, again. Honey, sugar, oleum centale, oleum jacoris and hydrocotyl. There's nothing, it beats the scrubs. Don't come to fight with me. These are the cosmetic stuff. It has to be treated cosmetically. If there is no PCOD or underlying cause, if there is underlying cause, treat the cause. But this need to be addressed in a cosmetic way also, because patients are not bothered about the PCOD or the menstrual problem, but the face problem they are more bothered. If we can't address it as early as possible, as fast as possible, the skin complaints and the pimple cases, we are going to lose that. Okay, so we are only using homeopathic medicines. We have enough of it medicines to use it in the cosmetics industry. I will tell you, cosmetic industry is so huge, where our presence in homeopathic presence is hardly not even 0.00000%, 1%, 0.00001%. So that is something we can get into it. Sulfur. I have given all the explanations of the sulfur medicines, which I don't expect the senior doctors and the juniors has to be explained. sulfur. Okay. Pulsatilla, belladonna. I'm just giving you descriptions of the medicines. Lactic acid, salicylic acid. I've told you what are the uses of lactic acid and salicylic acid. Huh. And acne rosacea, estrogen. Estrogen is one of the best medicine you can even think about it. Not common medicines. I'm talking about uncommonly used, but for me, it is a commonly used medicine. Sulfur iode, hydrocortisone, estrogen can be thought about it. Estrogen is one of the best medicines where you can use it for the pimples. If there is a polycystic ovary or any uterus abnormality, if there is a fibroid also, we can think of fibroid and pimples. Think about estrogen. Cosmetics, I told you, Asteria rubens, all that. Indurated carboanimalase. If there is a sexual desire as a nymphomania patient gets pimples, think about acid phos. Huh. Alopecia. The medicines are selenium. Selenium is one of the best medicines. Syphilinum cannot, alopecia areata, in my experience, cannot be treated without syphilinum, including almost all the alopecias, except if there is a cause is dandruff is there or any other cause is there. Uh, Otherwise, hereditary cases, if you take a family history, you will get it. 90% of the cases. Without syphilinum, I don't know whether I could treat a case of hair fall. Okay. Testis is one of the best medicines. If there is a polycystic ovary, why testis? You will say that I'm contradicting it. In PCOD, what is the problem is testosterone is high. Whereas the male testosterone is produced mostly in the testes as well as in the kidneys. Okay. What is the homeopathy say? Homeopathy says equal treats equal. So testosterone treats testis. Medicine is used to treat the pimples of alopecia. Why is because I have got this uh, from the book which I studied in fourth standard or something. The Malayalam Punniraman. The male picture what we got it as Punniraman is with hair in the ears, the that chest, hair in the chest. That is a picture we got it when we are in the kids. A Malayalam Kerala book, Malayalam Kerala language book explained Punniraman as the male epic of male. If this is the male, he is the replica of the male. So in that Kashanti is that is baldness is explained. So once we that way, baldness, if it is the explanation of maleness, what is the male hormones made of? Testis. So go for it. This is my explanation for the testis being used. Okay. Thallium. That is one of the best medicines. I have pictures. I have enough and more pictures of hair falls. Okay. Thallium, the best medicine after any fever, even if it's a viral fever. Thallium and alien sepa, hair fall after weakening diseases. Thallium is one of the best medicines used after COVID. Hair fall after COVID. No other medicine helped me. Okay. Thyroidinum, Baretacap, another medicine which I frequently started using is Hepasol. If it is after 2 days, one patient is coming with complete, almost totalis. In 1 month's time, hair follicles have started coming. They have seen a lot of doctors. that picture, I have a one or two pictures, but that doesn't show that this one. This October 1st, that patient is coming to me again for the review. You will wonder how the follicles are coming from the head. It is total barren. I'll put you the pictures of that girl. She's almost 9-year-old girl, 7 to 8-year-old girl, and beautiful hair follicles coming up. I never expected this because it's almost a barren head. There's not even a single follicle, and the homeopathic medicine doing such a wonders. And this is something HEPA sulf. In that case, HEPA sulf. We never think about HEPA sulf in the hair conditions. Alopecia hair, this one, if it is a total hair in spots, HEPA sulf. Okay, use that. That is one of the best medicine, and that is the only medicine given in the repertory for this alopecia areata in total. I'll give you the explanation for this medicine. And oil I use. And oil I use. And oil, the main ingredient is castor oil. Why castor oil again and the oil is? When my childhood or when my teens, my friends used to say, when you don't get mustache, when you don't get beard, they said that go and use castor oil. I never knew how far it was going to help me in my practice or my life. Castor oil is one of the best medicines externally, even if it is internally also. Castor oil, a crude castor oil. Castor rico is there. We have a medicine, castor rico for the nipple cracks. This is castor oil, double refined castor oil. You take it, put it, coconut oil also mixed with homeopathic medicines. Nothing has been used other than I make my oil. Okay, anyone can ask me for the samples. I will give it. Don't worry about it. Okay, yesterday also I gave it in the seminar. One or two doctors asked me. I have given it to them for the sampling and let them go and do it. I give it only for my patients. No, it is not on a commercial sales. So I make sure that all the medicines are there, properly taken. Okay, anyone, if you ask me, I can explain you to what are the all the medicines used, what ratio, how is it. Okay, you can call me with this anytime. And carbuncle, anthracinum, gunpowder, Prophylandra, scolopendra. Scolopendra is another medicine. Scolopendra, we have not used it. It's one of the rare medicine. For I don't know how many people have used it, but I have been using it. Carbuncle cases, you get it very, 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 very rarely. Maybe in a year you get 4-5 cases if there is a highly diabetic and ulcer forms. Those cases, this has been used scolopendra. Okay, again given one line, carbuncle. Try it out, try it out, try it out. How do I get it? As when we don't get results, we search, we read, we do the research. We expect that okay, gunpowder will help you, but in some cases we don't get the expected results. Gunpowder, you can go give the constitution medicine, but constitution medicines, in my cases, when the two acute cases are there, acute presentation is there, constitution medicines will flare up the case and spoil the case if it is given. So please restrict to the acute presentation. We have it in our hand. In case of skin, certain cases, pemphigus, certain times pemphigus is a constitutional or is a chronic expression. So we need to give anti-miasmatic and this. These are not this one. This is an acute presentation. So give only acute medicines. Control this, heal this. Then you can go for a constitutional treatment or miasmatic treatment or whatever the way you wanted to deal with the case. You can deal it. And cones. Crohn's is one of the toughest things to heal. I have the photos, I think, in this only. Okay. Acid picricum, antim crude, silesia, and sulfur. These 4 medicines are more than enough. Tuja is the medicines are there, but Tuja nowadays I use very less. Acid picricum, if you can give it in a higher potency of 10 m. Antim crude 10 m. Antim crude why? All the eruptions are thick. All the skin complaints are thick, blackish. That gives the skin also very thick. Silesia, again thickness.
Sir, we have only 1 minute.
Okay, then I can continue next time.
Yeah.
Oh.
Thank you so much, sir. As usual, you have showed many incurable cases according to many others. But really wonderful cases you have shown. I think Dr. Ram Parvesh sir is asking something. And someone asked about the potency. I don't know for which medicine.
Whatever the medicines are, potency is the doctor's choice. And depending on the condition, because they are seeing the case. But
Yeah.
usual practices start 30. 30, what is the advantage is you can repeat frequently. And with the experience, go up. And repetition again on the doctor. But with me, I go crazy with the repetitions. More the repetitions, more the results I get.
Okay, thank you, sir. Dr. Ram Parvesha, sir. Please say a vote of thanks to Dr. SADAT SAIT. And now it is the time for the Malayalam session. You can ask now, please. He went. Where is Ram Parvesh? He left.
No, I think sir is there. Sir is there. Sir is there. I saw him.
Thank you, Dr. Anjani, and congratulations. Dr. Seth, sir, very nice, excellent session. Skin complaint and incurable disease, varicose vein, gangrene, etc., and multiple acute remedy. Oh, very, very thanks. Behalf of IFPH, whole team, thank you again presentation. Thank you, sir. Thank you.
We missed you here, sir, yesterday.
Yes.
Thank you so much, all the participants. Now we are moving to Malayalam session. I'm inviting Dr. Mariamma John for moderating Malayalam session. You are welcome, Doctor.
നന്ദി അജിനി ഡോക്ടറെ.
ഡോക്ടറെ ഞാൻ ഹോസ്റ്റ് ആക്കിയിട്ടുണ്ട്.